Welcome back to the Population Health Collaborative Conference. As a reminder, this meeting is being recorded. Attendees' cameras and microphones are activated today. However, we do ask that you keep your microphones muted. Following each of today's presentations, we will have time for Q&A. You may ask your questions live or post questions in the chat window. And you can join the discussions online through our discussion forum at nmhealthequity.org/PHC. Today, we are excited to host Dr. Jennifer Gomez-Chavez. Dr. Gomez-Chavez has 30 years of experience working on issues of diversity and equity. She holds a BA in criminal justice, a master's in counseling, and a doctorate in educational leadership. Dr. Gomez-Chavez is currently the Special Assistant to the Associate Vice Chancellor in the Office of Diversity, Equity, and Inclusion at the University of New Mexico's Health Sciences Center. Please welcome Dr. Jennifer Gomez-Chavez.
Buenas tardes, everyone. It's such an honor to be here with you this afternoon to share with you about the collective impact framework. And so I'm going to quickly pull up my slides here. But before I do, I want to thank each of you for your tremendous leadership, for all that you do in our community to continue to uplift and support New Mexicans. So thank you so much for doing that. Let me get to my slides here. This is always tricky, right? Is how to get these up here. Let me see here. Bueno, pues, ahí estamos. And there we go. Again, it's such an honor to be here. I want to introduce myself quickly. My pronouns are she, her, and ella. I am not just an educator, or as I consider myself a community leader, I am also a person living with MS. So I come to you, bringing my different perspectives, my cultural background, and am grateful for this opportunity. I want to also acknowledge, here at the university, in many areas of New Mexico, we want to honor our native lands that we stand on every day, and the history in the history that we want to uplift our Native American history and heritage, to also acknowledge their contributions. So today I'm really, really excited to talk to you about collective impact. And so what I will be discussing and reviewing, and then we can have a discussion after, is what is collective impact? The collective impact model, collective impact in action, collective impact challenges, because with anything, right, there's always positive as well as other challenges with any framework that we work with, and how to be an equity champion. So, I heard a little bit about the discussion earlier with you all. And, there is this national movement on how we work together, how we can better work together to solve social problems, to solve health inequities, to address many things that are happening nationally, statewide, and locally. And so collective impact has been a framework that has been around for, I'm going to say, more than 10 years. It has re-emerged because of funding organizations or philanthropic organizations that are looking at how they can have their best return on investment. So they've helped us push our thought process and perspectives on how we work across organizations and how we work across institutions. So I have collective impact training, and you're going to hear how that happened. I try to use it every day, every time I'm working on an initiative, because it is a bit of a different framework. And personally, I really want to make sure that I have my collective impact lens and my equity lens as I work to solve issues, as I work to support our community. So one thing that I do love about collective impact is it moves us from the I, because many times it's individualized credit, and people are, you know, I think wanting to, you know, really advance their resumes to say that they've, you know, come up with this solutions. But with collective impact, it really is about shared leadership and shared credit. So it goes from the I to the we. And with collective impact, I feel like there's a greater impact, a greater reach. And so I'll go through some of these examples so that you can see how this can promote a greater reach. Now, before I begin, I don't know how much to stress that this is one model, and this model is not perfect. And there are other models out there that people use, but I have chosen, and we have chosen as some areas of our state and some educational institutions to use this collective impact framework. So as we know, well, I believe that, you know, the traditional approaches where we want to solve an issue, where we, you know, a problem comes up and we rally our own team members within our own organization to say, you know what, we need to do something about this. And so we begin to work in that mindset. But what we've noticed, and you all, I'm sure, are aware, that working in silos oftentimes is not the best approach and doesn't have the greatest reach, right? So the traditional approach is more isolated. And what funders now are really looking at is to fund collective approaches so that there is a greater reach, resources are shared, and we are doing cross-sector alignment, which means that you're thinking about all the leaders, all team members, not just within your organization, but within other organizations, possibly doing the same work, maybe similar, but bringing them together so that you can have a true impact. So we have moved, so nationally, we have seen the trend of single organizations versus multiple organizations coming together with multiple players. So as I go through this, you know, I often tell community leaders, you know, team members to think about this. And I want you to think about these questions as I go through the collective impact framework model. Evaluate your own organization. Are you collaborating, or are you practicing collective impact? What steps can move you from collaboration to collective impact? And are you truly using an equity lens? So as I go through this, just keep these in mind. So what is collective impact? And I've already reviewed something with you, and it's some of these things with you. It's really looking at a goal to solve complex problems. In all of our organizations, as I look to who is attending and I look at each of our organizations, we are every day trying to solve complex problems. And the goal is to bring separate organizations and entities to work together, to work collectively so that we can have a major impact. But the ultimate goal is just not in the numbers. The ultimate goal is to make systemic changes. And if we're looking at equity, if we're looking at issues in education, housing, food, all of those areas and more, any issue that we have to be a part of as just everyday human beings, right? There's always challenges within those areas. For improvement, we know that it can't just be about the numbers, but it has to be systemic changes. So here we go. The commitment, collective impact, is the commitment of a group of important actors from different sectors to a common agenda for solving a specific social problem. Again, as I said, every day we are facing this. Now, a lot of people come to me and say, we think we're doing collective impact. And what is the difference between collaboration and collective impact? Because sometimes it seems like we're collectively working together, but in fact, we're doing more collaboration. So these are some of the differences that I want to make sure that you understand. So collaboration is defined as a joint effort toward a goal. Okay, collective impact is described as the commitment of a group of important actors from different sectors to solve a specific problem. So as you see here in this slide, you bring people together. A lot of times it's within the same areas of the work that you're doing. You're trying to prove something. You're adding to what maybe you're already doing, and you're advocating for ideas. In collective impact, you're really working toward moving toward shared outcomes. You're bringing together individuals to try to make improvements, not to just prove, but you're trying to make improvements in systems, in numbers. And it's every day what you do. This isn't just something that you're like, okay, we have an issue, right? Every day you are practicing collective impact. You're being proactive and you're really practicing it. And you're advocating for what works. So I often use the example of, we want to raise graduation rates, either at the high school or the college level. And what do? We put a rate up of our goals. So we're trying to prove that we can raise the graduation rate. Okay, collective impact is inviting individuals, stakeholders from many sectors coming together, developing a shared goal, developing shared practices and outcomes, and trying to advocate to make systemic changes. So it's just not about the number. And oftentimes that's what we rally around is, let's increase this number because that's going to make us feel better. And when we do that, that might work for a little bit of time. but the long-term impact might be short-term versus long-term. So now I'll review the 5 conditions of collective impact, and then I'll break these down. There's common agenda, understanding what the problem is, coming up with a shared vision. The shared measurement is really important because together the stakeholders will determine, what data do we need to collect so that we can really focus on making improvements. How are we going to measure our results? Okay, how are we going to hold ourselves accountable? So shared accountability, mutually reinforcing activities. What are the different strategies and plan of action that is going to get you to reach your goal? Continuous communication, which is so critical. And as we heard before, how do we work with community organizations? Because oftentimes we're within institutions and we have our own policies, but how do we keep other entities engaged, our other partners engaged with transparent and open communication that really honors and creates trust with our partners? And then backbone support. So there's, sometimes there's a separate organization, sometimes there's identifying an entity within, within those sectors that can serve as, basically the neutral party that convenes everybody, that coordinates all of the activities and ensures that the momentum keeps going. This is hard work. Collective impact is hard but rewarding work. And so that's why you need the backbone support. So let's break it down. So the first one, again, I said common agenda. And I think this is one of the most challenging areas of collective impact, because oftentimes people bring their own agenda. People want their own goals, right? So you have to agree on, what the problem is, what goal, because you want to solve so many things. I mean, there is so much need in our state. But what is one thing that we can do together to make an impact? The next one, so this is an example. I like to give examples so that people better understand the collective impact framework model. And so we were one of 13 communities in the entire nation. So the University of Mexico was one of 13 institutions. Albuquerque was one of 13 communities. There was 65 applications, and the Lumina Foundation was reaching out to communities to increase Latino student success. And that foundation had a big goal. But then they said, we can't do this alone. We have to go into across the nation. So Albuquerque was one of 13 communities that was selected to work on Latino student success across Albuquerque Public Schools, CNM, and UNM. The next one is steps to reach a common agenda. So, you really need to work with the group to identify the principles. You need to identify what is the problem. I already talked about that, and the goals. And again, you don't want to, we want to address so many different things, but we want to make sure that we have goals that we can measure. And so you will work toward shared measurements, look at the data, and also continuous planning for learning. I can't stress this enough. A lot of people come to me and think that I'm an expert in collective impact. I continue to learn. Every day is learning for me. It's basically a life learning, exactly like with equity, diversity, equity, and inclusion. You never reach full competence. So with all of the partners that you bring in, you have to stress that they have to be open to learning and open to shifting, because sometimes in collective impact, you might plan for this big goal, and then guess what happens? Things change. So you have to shift. And so there needs to be flexibility as well. The shared measurements, I've already talked about this. You know, you definitely want to have common indicators where you can identify, you know, what the activities are, as well as what are the improvements that you want to make. And most importantly, everybody needs to have a voice. Okay, these cannot be set out and you can't come to the table and say, this is what I think we need to do, right? Because oftentimes, I'm going to give you the example again of graduation rates, whether high school, college, you know, oftentimes people will say, okay, this is what we need to do, versus what do you all think? What do you think would work, right? In this instance. So honoring voices and making sure that everybody has input. So these are, you know, when we were again awarded the Latino Student Success Award from the Lumina Foundation, this was how we identified our shared measurements, our stakeholders, and our data. These were the individuals that came to the table. The public schools, the higher education, policymakers, employers, community-based organizations, which I might add, oftentimes have the best solutions and best practices. And sometimes we don't honor them because we feel that they're not within an institution like a higher ed or public education institution. We also included Latino advocacy organizations. All of these entities came together to address Latino student success. So now we also, the other area is mutually reinforcing activities. And this is so important because numbers only tell and can do, you know, tell the story. But the activities are what's going to move us to the goal. So you have to work across sectors. You coordinate and identify different activities for different levels, right? Sometimes it doesn't take one strategy, it takes multiple strategies and activities. So here, as I have an example for Latino student success, what we did here is we said, okay, we have to identify mutually reinforcing activities that will be at different levels. So we looked at strategies to increase the greater number of students, strategies to bring back students, strategies to inform families and community of the power of education, a strategy on removing systemic institutional barriers. So these were the 4 strategies. And as you can see here, these are water drops. And I'll explain a little bit about that because it's really important to apply the framework to speak to your community so that it represents the community that you're working with. Oftentimes we want to do, you know, we want to represent based on national symbols or logos. And for this, effort, we felt we needed to do something culturally where we could really represent the culture, the history of New Mexico, the language, and where people could identify what the work we were doing meant, was a model that people could understand what we were trying to do. So continuous communication, we know that is so important, but oftentimes we don't do it enough. And sometimes it's one and done. And so in my work as a community leader and working with community organizations, I can't stress the importance of relationship building, of honoring other organizations, other leaders. Now, this takes time again, but that is how you can create trust. And I know some instances trust has been broken, but you can regain it. And that's what I love about collective impact, is that continuous improvement, the learning, the re-engagement, and opening, the open communication and the transparency. So I just want to go through this too, is that with consistent open communication in the Unidos project, which was the project of our Latino student success, there were, we had 4 different strategies, but in our model, we decided to hire, a community liaison. And the community liaison really worked to keep, to gain buy-in, to identify key partners, be the neutral party, because in working with students and families and even community organizations, a lot of times we've lost the trust of community. And so the community liaison helped build that trust, helped maintain that commitment, and really helped us think about grassroots organizing. This is the model. We did the acequia model. We responded with a cultural framework that would speak to New Mexico, which is acequia. And we all know that the acequias here in New Mexico are historical. Water is so important to keep our land and our crops going. And so we created the different strategies based on the acequia model. And you know, acequias, they have the different areas, different components that we have to do to keep the acequias going. So that's where we saw the students moving through the water. And backbone support is just as important. In fact, it's critical because they provide that ongoing guidance and the vision and the strategy, and they keep the momentum. Again, this work every day, what we're trying to do, the impact that we're trying to make, what we're already trying to do, right, takes a lot of work. And sometimes we have to rethink how we're doing things. But a backbone support offers, you know, the administrative support, the organizational support, the resources to keep that momentum going. So I have this here, which I won't go through, but again, these are the different components that we brought in: families, policymakers, community organizers, the public school system, community, a college. And again, these are the 5 conditions of collective impact: the common agenda, the backbone support, the shared measurements, the mutual reinforcing activities, continuous communication. Oftentimes people, you know, think, what is the timeline for collective impact? With the Lumina Foundation, we were given a year of planning because we were being trained on the framework, but we were given a year to think about and honor historical initiatives and movements. And that's something that I really want to drive home, is that oftentimes we start initiatives because it's based on a person's idea. And that initiative might have already been started or tried many years ago. So I'm going to challenge all of you all, before you start a collective impact framework initiative, think about, has this been done before? Can we build on what was already tried, right? But here there are different phases. And yes, you can work quickly through a collective impact framework, but you have to be very intentional. And again, you want to check yourself. Am I collaborating, or am I really doing collective impact? I will provide these slides to Suzanne and her team so that you can have these as well as you see the different phases here. So here are just, collective impact models in action, because I want to leave about 10 minutes for questions. The Unidos project, which I spoke about, to increase Latino student success across Bernalillo County. This is Unite Us. They have a health equity where they're working across sectors, governmental sectors, policymakers, community, health organizations. Community schools is within APS, and they're a form of collective impact where they are trying to bring together a one-stop impact and support for students and families. And oftentimes we don't see community schools as a collective impact model. But what they have done is they're shifting the systems of the way schools operate. We do not look at schools, right? They're not looking at schools as places just for education. They're looking at schools as the whole child: health, academic support, community development, parental and family support. So this is a framework, an example of collective impact in action. So quickly, the challenges. There's always challenges of collective impact. Communicating. I think for us, the hardest thing for us was building relationships, because people had already been addressing Latino student success for many years. And how were we going to honor that? And people feeling like, okay, we've already tried this. This isn't going to work because, we're tired. People have been exhausted, right? So there's, there is exhaustion to keep trying to improve things in our community and for our community, to keep advocating, right? Because we're working with organizations and governmental agencies who have systems in place that oftentimes, not oftentimes, but sometimes they don't work. And so it does get tiring. So, recreating trust, developing continuous learning and review. And I think the implementation was somewhat challenging, because who do we engage? We wanted to make sure that everybody who needed to be there was invited. And how do we sustain the work? Lumina gave us money initially, but then how are we going to sustain that? And most importantly, the leaders who knew about collective impact had retired, had gone to other institutions. I'm talking about the APS superintendent, the president of CNM, the president of UNM, the provost, all the decision makers, right? So you continuously need to keep them informed. So as transitions happen with collective impact, again, you have to keep people who have transitioned out and in engaged. And then the evaluation. How do we know that we're being successful? What is true impact? What is true impact in the students and families that are being served? What are the systemic changes? What are wins for us? So these are some of the challenges. And again, I talked about creating a culturally responsive organizing model. I already talked about the acequia model, which is really important, the water system, to be able to represent and connect our community to this important effort. So again, you're going from an isolated impact to a collective impact where everybody is going in the same direction versus people trying to address issues on their own. And oftentimes we get frustrated because we're like, oh, let's just do it. Because in collective impact, it's being patient, it's listening, it's adjusting. It's really taking off our titles and being equal with one another. And I think that's what's hardest, right? Because we leaders are fixers, we're doers. But collective impact is to listen, to honor and respect, and to know that we don't have all the answers. And our single organization can't do it alone. The resources, time, support is greater to have together than alone. So from silos to cross-functional roles, we did this across educational institutions, results-oriented. And then before we get to questions, I just want to, as you do your collective impact and as you work on different initiatives with your own organizations, I'm going to challenge you to be an equity champion. I need you to speak up and out. Maybe for things that are said that don't bring light to different communities. Look around your table and see who's missing, whether it's gender-wise, sexual orientation-wise, race and ethnicity-wise, rural versus urban. Yesterday, I had, I'm coaching a national, a state organization, they're national too, on equity because they're not diversifying their workforce. But when we started looking around who their board is, who's involved in their different initiatives, not very diverse. So I'm asking you to make an extra effort. We're in New Mexico, one of the most diverse states. We have people who can help you, and they might not be in our institutions, but they're out in the community and they're willing and ready. So make space for them and keep learning. Be open to learn. We are learners. We're lifelong learners. We don't have all the answers. And this is why I love collective impact, because I continue to learn from community, from other leaders, from organizations, from institutions on how together we can set aside our differences, but come together to make an impact. So here are some resources. And again, I'll send these to Suzanne. And with that, I'll stand for questions. And thank you so much. You can see that I'm really excited about this. I appreciate everything that you all do. And I want you to consider the collective impact framework.
Thank you so much, Dr. Gomez-Chavez. You did a similar presentation for us at the Summit on Health Equity, and I loved it so much. And I really wanted to bring it to this group here because this group is working on their own projects to reduce the burden of cardiovascular disease in New Mexico. But I felt like it really fit with the work that each of them is doing. Can you talk a little bit about, I mean, we have contractors who are, in different states, from West Virginia to Wyoming to here. They all have their own specialties. Can you talk a little bit about what we as contractors and individuals working on these projects can do to support a collective impact model?
Yes, thank you so much for that question. I believe that, if you want to be a part of it, number one is your time. Oftentimes, people want to throw money at collective impact. What we found with our collective impact model is that people were just excited to come and contribute because they had never been asked to work in this form. So we need your experiences, your voices, your perspectives. There might be times that you might be able to contribute funding wise, but so I would say just advocate, to wherever you're at to work in a collective impact framework. And so, now we're virtual. That can happen. People can come together virtually to do just that. But I think my answer is that if you're willing and ready to do the work together and for others, then you reach out, and if you're asked, you say yes and.
Great, thank you. And if anyone else has questions for Dr. Gomez-Chavez, please feel free to put them in the chat window, or please feel free to unmute yourselves and you can ask the questions directly. We'll give it a couple seconds. I think while we're waiting, one other question that I had, from our work at the National MS Society way back when, a lot of the conversation was around working we were working in silos. Have you found, or I guess, what have you found when organizations start participating in the collective impact model? What happens to those, quote, silos that everybody's working in? How have you seen that progress?
Well, I think that there's more momentum and greater reach when you come together. You can share resources so that you can, you have greater capacity to impact, whether it's funding or a shared position. So I think, the hardest thing I think is to get people from siloed to understanding on how it's important to work together and what is the impact, what is the return on investment if you do collective impact, right? But again, I think people think they're already doing it and they get often confused with collaboration, saying, oh, we're going to have, you mentioned the MS Society, but, saying, oh, we're going to work on, this initiative. But, you bring in some partners, but you work on that initiative and that's it. You don't think of the long-term impacts that you can have, the systemic changes. And oftentimes not everybody who needs to be there is at the table. So for example, in education, even in healthcare, because I work at UNM HSC, we often forget to invite students and their families to hear their voices. We often forget to bring in patients, our customers, So it is hard work, but the rewards are long-term impact.
Awesome. Thank you so much. I don't think we have any other questions right now. So again, thank you so much, Dr. Gomez-Chavez. It was great hearing you speak again.
Thank you so much. Best of luck.
Thanks. And before we move into our break, if attendees can please complete the poll that has popped up for you just now, we would appreciate it. This poll is just a few questions and it's anonymous and will help us in our QI efforts. We will now break until 2:15 when Stephanie Hedrick of Durand Central Pharmacy will present on pharmacist's role in reducing the burden of cardiovascular disease. This Zoom will stay live during the break and we will see you back at 2:15.